When I was 15 years old, I started spending some time with doctors in our community. And I spent to see post-op patients. And when we walked in the room, I saw this beautiful, vibrant lady who had just undergone a procedure. And he asked me to go get the photographs from her before. And we went and looked at those photographs, and really what I saw was this incredible transformation. And when I looked at my interests, well, my father was a doctor and my mother is an artist, it really fit kind of what I thought would be a great career choice for me. At that point, I decided that facial aesthetic surgery or cosmetic surgery would be my chosen career path, and I've never looked back since. I started my practice here 13 years ago. I came from California, where I had completed my fellowship at UC San Francisco. My wife is from the area, so we really decided to come back where her family is located. And we just saw Naperville as being a real up-and-coming area, an area where there's a lot of families, and certainly we've seen that grow, and just this has grown into be quite a community, and we're really proud to be part of it and to have our business here in Naperville. Naperville is 30 miles west of Chicago, downtown Chicago. It's really a bedroom community of Chicago, but it's interesting. It has all the amenities that Chicago has. We've got all the major restaurants that have come to the area. I think Money Magazine had ranked this the last 2 years as the number 2 and 3 spot in the country to live. That's based on schools and availability of restaurants, entertainment, all those things. Over 95% of the people that actually live here are families. So it's probably our demographics are 40 to 50 years old. Artistry is a very important part of what I do, and understanding aesthetic sense, what looks nice. It's very important when you're talking about transforming somebody, and that's really what facial plastic surgery is about. My first consultation with a patient, I'll spend about 45 minutes talking to them. And we'll use actually cosmetic photography and imaging to actually look at the possibilities. It's real important for me to really understand a patient's goals. That's really the first thing I ask is, what are your goals? What would you like to attain? And if their goals can be met with what I can do for them, and then I show them with computer imaging, and they really have the same expectation, then I know that we're really a good fit and it's a good match, and that's someone I really would like to take on as a patient. I don't show anybody more than we can achieve. It's really managing in the expectation. It's a wonderful communication tool. Computer imaging is a way for patients to really see and understand what the types of changes that we're proposing or talking about, what can be achieved. Most important thing for me is having a good outcome, happy patients. I mean, that's a win for me, it's a win for my patients. And I certainly take the time to really talk to people, to really understand, again, as I said, what their goals are, so that I can make sure that we have a very high chance of obtaining their goals and really getting a good outcome and having a very happy, satisfied patient. That's what my practice is all about. It's about building long-term relationships. It's about having patients come back again, and they know that if I recommend something, that they can be sure that I really believe in it, and that they're going to get a beneficial result from the procedure that they would undergo. I really have focused my practice on facial aesthetics, and probably I can break it down into 2 different categories. I'd say one is the aging face, and within that it's really restoring 3 different things. Restoring volume back to the face, because as we age we lose volume. Lifting the tissues, because with age and gravity tissues drop. And then also really treating the skin and the damage to the skin from years of sun exposure and just years of aging, wrinkling. So those 3 components are very important to really put together 3-dimensionally to really achieve the results. On the other side of it, rhinoplasty or cosmetic surgery of the nose is something that I do a lot of. Rhinoplasty is form as well as function. And what I mean by that is we're changing the form or the appearance of the nose, but it's really absolutely essential to retain the function or the breathing through the nose. And certainly if you change the function, yet you achieve an excellent form, you have, again, a dissatisfied patient. It's so important to me to really maintain both of those, form and function, and really get a good result for people. We really have two different groups of our staffing. One is really the front office staff, and they're the staff that initially meet patients, talk to patients about what procedures we do, and they're the gateway to our practice. On the other side of our practice, because we have a Joint Commission accredited operating room, we have our full surgical staff, which is our anesthesia people as well as our nurses. And they really take care of the surgical experience for our patients. They meet the patients the day of surgery, take them through the whole experience all the way through home, delivery back to their home, or if they're going to an overnight care facility, and then are involved in some follow-up. So we really, both of those groups of our staff are very important to us to ensure that patients really have a very pleasant experience when they're coming to the Center for Cosmetic and Laser Surgery. I'm always available to our patients. It's really essential, as I said, to build that relationship with my patients. From the day that they come in for our consultation all the way through the surgical process, I'm available for them because this is a significant decision for people. I understand that, and I really want to make sure that they know that I'm really there for them through this whole process. We take a lot of time to talk to all of our patients to really explain the whole process. I have a 30 to 40 page handout or manual that I give all of my patients before any surgery, so they really understand the entire process, the process of what to expect, swelling after surgery, the healing, the entire thing from the beginning to end is really laid out for them. It really alleviates a lot of anxiety. Everyone's going to be nervous the day of surgery. That's an absolute given. It's understandable, and I explain that to patients. But I think that the more information that you can provide, the better potential experience that they're going to have.